You can significantly reduce neck stiffness and restore your range of motion in under a minute using movements that require no medical intervention. When your neck is injured or under constant strain, your body enters a protective mode. Certain muscles begin overcompensating and gripping, while others weaken from disuse. This schematic shows neurological guarding. The brain triggers spasms to limit movement, but this response often outlasts the injury. We communicate directly with these pathways. Contracting against resistance, then relaxing into a stretch, signals the brain it is safe, allowing it to release the guard. To perform this protocol, you will need a single tennis ball and a flat surface to lie on, like a bench, a rug, or your bed. Using specific muscle signals to lower the body's internal defenses is more effective for chronic stiffness than forcing a stretch through a spasm. Lie flat on your back and place the tennis ball directly under your chin. Tuck your chin down toward your chest, pinning the ball securely in place. Maintain this downward pressure for 10 to 20 seconds. This diagram shows the exact force vector required. This activates your deep neck flexors. These internal stabilizers commonly atrophy in chronic neck issues. Re-engaging them provides the foundation for spinal health. Activating these weakened stabilizers is the first priority, as they provide the structural support needed for the flexibility exercises that follow. Now move to a seated or standing position. Lower your chin toward your chest as far as your current range allows, and interlace your fingers behind your head. In the resistance phase, push your head upward against your hands. You are creating tension, but do not allow any actual movement. The intensity must stay within 10 to 30% of maximum effort. Hold this light isometric contraction for 10 seconds. Completely relax and immediately press your chin further toward your chest. This deepens the stretch into your newly expanded range. The effectiveness of this neurological release is immediate. You'll likely find your chin sits tangibly closer to your chest than it did 20 seconds ago. To address rotational tension, turn your head as far to the right as you comfortably can. Place one hand lightly against your chin. Push against your hand as if trying to rotate back to the center, but hold perfectly still. Maintain this mild tension for 10 seconds. Remove your hand and use your neck muscles to rotate even further to the right. Hold this deeper position for another 10 seconds. Complete 3 rounds right, then repeat the same resist and deepen cycle to the left. This systematically releases the rigid fibers restricting your side-to-side movement. This targeted release of rotational tension results in a significantly wider field of vision and a reduction in shoulder tightness. Carefully tilt your head back to look at the ceiling, placing your hands horizontally across your forehead. The neck is highly vulnerable in extension. Use only the slightest amount of pressure for this movement to ensure safety. Push your head forward against your hands for 10 seconds. Use minimal effort, just enough to engage the muscles without straining the joints. Relax for a moment, then actively push your head further back toward the ceiling for 10 seconds. You are safely restoring your extension range. This specific direction of movement sends remodeling signals to the small facet joints of the spine, encouraging healthier alignment and reducing local spasms. Gently roll your neck from side to side. You should feel an unlocked range of motion and a significant drop in stiffness. If you feel sharp pain, dizziness, or any sensation traveling down your arms, stop these exercises immediately and consult a professional, as these can be signs of nerve involvement. Perform 3 sets of this protocol once per week. Regular, gentle sessions are more effective for long-term joint health than aggressive, infrequent workouts. These movements signal the facet joints to begin producing more collagen for repair. You can support this physical remodeling by maintaining an anti-inflammatory diet and prioritizing sleep, providing the raw materials your body needs to rebuild joint tissue. Lasting neck health requires the combination of neurological safety signals and the biological support necessary for cellular repair.